patient, and I am not making a presentation because I want to this session interaction. So I want to ask you, then you will inform me what you have and what you will deal how to are dealing with the patient. Okay. Before we will start with the insulin, I want to ask, when the patient arrives with hypoglycemia, and the hypoglycemia is below 70, like 59, what you will do? Apple juice. Here we have a store like before, sir.
If the patient is conscious, if he can tolerate fluid, we can give apple juice. If the patient is unconscious, or we can give hypoglycemic.
Yes, this one. Okay. Right. If the patient conscious at 59 and you start give half cup orange juice, half cup, okay? After 15 minutes you have to check, okay? Not before that, because the glucose in the sugar it need 15 minutes to absorb, okay? After 15 minutes I will check like 60 or 65. What you will do?
Another half.
Great. Okay, another half cup juice. After 15 minutes, it's still hypo. What you will do?
We can give 15 grams of carb.
No, the carbohydrate don't
Below
get
70.
yes, below 70. Should be after 70 because the complex carbohydrate it take time to make absorption. That's why we start with simple sugar. Okay. Immediately we are dealing with the patient juice with sugar.
Yeah.
You can shake
One sachet?
One sachet.
Here
Or
in
half?
the hospital before we are put three. Yeah. To be safe, put 2 in 1 cup of juice and try to give half after 15 minutes. If it's still hypo, you will give another half.
With the sugar again?
With the sugar.
Okay.
If the blood sugar after the first cup juice up to 70, you will give
the
complete
carbs.
carbohydrate, one carbs. Okay. If after again, if you give half cup, you give complete carbohydrate. If the patient he take two half, yes, you will give again after 70. You will should give 1 carb. Okay. Right. If the patient unconscious and hypoglycemia, what you will give?
After maybe the two, we give the juice half, still the
Still hypo.
still below 70.
You
What do
give
you
juice till you give juice till until you reach 70 and above. You will give complex carbohydrate.
So we can still juice plus
Apple
the
juice.
first one without sugar, the second one also without sugar.
With
you
sugar.
can start with sugar.
We are
You
putting
can
sugar
start
in.
with sugar.
Suddenly, if the sugar CBS is 59 or 60 like that, we will start with sugar
Yes.
apple juice.
Yes, but you have to wait 15 minutes. Very important.
So every 15 minutes we have to check.
Yes.
As long as it is hypo, we will give the apple juice.
Yes. Up to 70, you will get.
Every 15
Every
minutes.
15 minutes.
Until
like
70,
this,
we can give the carb.
Yes.
Before mom, tell me 10 minutes only. After
But
10
after
minutes.
No, should be
Ms.
15
Latifa,
minutes.
In the lecture, it was 10 minutes.
Okay, because maybe we took this one from the internet, but should be. I am talking. It's 15 rule. What's
Rule
the meaning of
15?
15 rule? 15 rule. You will start with 15
15
grams
minutes.
of simple sugar. You will wait 15 minutes. Then you will check. If the below 70, you will give again 15 grams, and you will wait 15 minutes. When you reach the 70 and above, you will give 15 grams of complex carbohydrate. Clear?
Yeah.
Okay. If the patient arrived or here and the blood sugar, let's say 76 or 78, what you give? Immediately complex carbohydrate. Don't give sugar. Why? Because the 70 it's not in risk. No, it's in the borderline. The complex carbohydrate, 1 carb, it managed this patient. Okay, when the patient with coma or seizure or unconscious, you will start give the glucagon. And everyone knows how to use the glucagon. Yes? You don't know.
Actually,
We get no worries. Now we are here to
learn.
no, but we
learn.
gave
Yes.
one time one of our patient in 316B.
You get.
Yes, seizure, patient and become unconscious.
You check. You
Injected
check
here,
first
we-
the
yeah,
CBS. How
CBS
much?
was 40 something only.
Okay. And what you will?
We did hyper.
How you give?
We have, there is order, no? According to the order, doctor will write how many in milligram or microgram. to
Milligram.
it's
Okay. Fine. When you open this one, you found one injection with saline. This one, water, yani saline, and this one the glucagon. Okay. This is a complex glucose. Just immediately you will remove like an injection. You will remove the cover here, then the cover here, and you will dilute. Okay, then aspirate. Okay, the dose according to the patient weight. If the patient weight less than 15 kg, if the patient 15 age, you will give half. Okay, but the doctor he will write the order.
Below 15?
Yeah, below 15.
Below 15, half only.
Half only. Okay, according to Dr. Al-Agha before,
Half means this is
here 1 and here half.
How many ml? does
How
it
many
have?
ml?
One.
So 0.5.
Yes.
Okay.
So this
Okay.
is 1 milligram.
Yeah.
So we will give 0.5 milligram.
Yes. Half. You will dilute, then you will aspirate half.
Anyway,
And then-
Dr. Hashim is writing.
Uh-uh.
And just for your info,
Info.
okay? Because sometimes the patient obese, even 10 years, you will give all. Okay, depend the patient weight.
Mm-mm.
Okay, it's very easy. How we teach the patient, because we give this pen to patient like the mother she gave during home, she can give to the patient. But in the hospital we can give this one as subcutaneous or IM. But in the patient home or the mother she gave, okay, you will inform her about the dose and how to give like sub-Q. And not hold that needle go in, no, half and subcutaneous and you give. After 15 minutes, okay, the patient maybe reach the blood sugar 500 or here in the hospital. You give insulin because the patient 500. You give insulin? No.
No.
Because it's this one make high
High.
glucose, then after slow, it's become down.
Okay.
Okay? It's very important. Right. During the meal time, now the patient here, he won't take the breakfast and the blood sugar is 78.
Meal time.
Meal time. What you will do? And the patient, each carb, he took 1 unit. The patient, he will eat 4 carbs.
We can
Okay, we can give as long as the patient will consume the food.
Yes, but you will, okay, the patient, he won't eat, okay, 4 carbs again. And the patient have hypoglycemia, okay, and I give 4 all carbs, but I give 3 insulin, 3 units, because 1 carb, it's managed the hypoglycemia.
Okay.
Because if I give whole insulin, the patient become again hypos. Okay. Okay. Right. When the patient he won't eat in lunchtime and the blood sugar 380. Okay. The mother sometimes said, no, I will not give because it's hypoglycemia, and when I give more food, it's more high. What I will do? He's in the hospital. Even at home, the same. The patient eat and I will give him to eat, but I make correction. Everyone now here, he knows how to make correction.
Yes.
The target minus, sorry, the CBS minus target
target.
divided the sensitivity factors. Okay, and the total or the numbers it comes from the formula, I will add in the meal time. Okay. Any question till now? Clear? Okay. If the patient, example, we talk all about hypoglycemia and how to manage about 15 rule. ask me if you have any question.
They're confused about the Actrapid and then the Humulin.
Actravit and the Humulin.
Humulin, the
The Actravit, this one Actravit. Okay, this Actravit. Okay, if you can be clear. And this is the same, Humulin R. This one and this one the same. Okay, but different name. Okay. And this one, MBH, but okay, MBH like this one, milk color, okay, cloudy, okay. And also we have mixed insulin. Oh, yes, insulin, because you know we have different name, okay. But the MPH it's a cloudy, and you reach here now like letter N. Okay, and we have another one insulitar, but it's not in the market anymore. But the MPH like this, okay, and the regular or Actravit clear water, okay, okay. Maybe you asked me about the snack. If the patient with insulin, Novorapid, and basal like Tresiba or Lantus or Tigio. Should the patient eat a snack? No.
Only midnight snack.
If the patient asks. Because you know, no peak. With this treatment or this insulin type, no peak. Why I give a snack? But we give a snack when the patient feel hungry, and I will make, I will check with the patient how many carbs, and I will calculate and I will give to the patient. But with R or MPH with regular or Actravit, should I give a snack?
No.
Should I give a snack?
Yes, we can give.
With Actravit and MPH,
We can give every 4 hours snack, but don't give the correction less than 6 hours.
according to according to the
What we
doctor.
done is-
But I am talking in regular patient, regular patient with insulin, Actravit, okay, with R, should every 3 hours the patient he took snack. Why? Because you know this Actravit, okay, the patient he eats. I give this that insulin, and he eats after 3 hours. This peak and this peak, it's become like this. Okay, the patient will feel down, hypos. If I don't give a snack free without insulin, it's become normal. The snack free without insulin, okay? But some patient he took regular with Actravit with basal insulin. I give snack. According to Dr. Nasim protocol, yes, you give. But Dr. Fana, no,
No,
because
yeah.
you know this one
It's not
like
confusing.
rapid acting, okay? It's no need snack. But we have to follow
The
doctor
order.
Okay, but the doctor she wrote, she will write in the file, you give snack or not, even the file, okay? Everyone, I will give you my number. My number is with the Cyril or Mamshuji, and you can reach me in the through operator. Any patient come with DKA, you don't clear order, you can reach me immediately. I send one of my team, or I will come by myself.
You know, I have one admission now, DKA,
Okay,
but he's already off DKA almost around 3 o'clock, 4 o'clock.
clear.
So the patient was NPO, then doctor ordered once off DKA we can start diet.
Yes.
So we have only the snacks available, 2 carb, 2 bread, so that is 2 carb.
Yes.
So we have doubt actually, me and Marvi has doubt. We will give the dinner dose or breakfast dose of the carb counting or the correction only, because the CBS is 100 for some for
What time the
47.
patient eats?
Actually, after Tresiba,
No,
Doctor
the
Asha-
patient he eat morning or
no, 6 a.m. morning.
Oh, you will give the breakfast dose.
Yeah. Or dinner dose. Anywhere dinner and breakfast is
The same.
3 carb.
Okay.
So I have a clarification. We confirmed with Dr. Shaima, and Dr. Shaima did not answer the phone, so we asked the pediatric ROD. He said, give only the correction. But Dr. Shaima
That's correct.
called me back. She said, no, it's not correct. We have to give the dose for the
Yes.
breakfast.
Real dose. Why? Correction, the main correction, what's the meaning of correction? I give extra dose about the CBS high. If the CBS okay and the patient he want to eat breakfast, lunch, dinner, I give only about the patient what he eat. But example, the patient, you mean you don't have yet the ketone is free now, no more ketone. And the CBS, let's say 100,
120, 140 like that only.
it's normal. Should give the regular dose. If the patient he took each one carb 1 unit, he will give 2 because he
Otherwise
took.
the CBS will go up, no? If you
Yes,
give the
yes. How to calculate correction if the blood
CBS is
sugar normal,
Yeah.
like 0, if 121, and the doctor said
Give the
how
correction.
yeah, that's
it's
why.
not it's not right.
No correction.
So she gave the 6
If
o'clock.
over
the-
100, if 150, below 150, if the, what's the one down?
The sliding scale
50,
No,
50.
from the CBS minus
CBS
100
minus
over 100.
over
Sensitivity.
100 over 75 over
Yeah.
depend.
If below 150, no correction.
No, some patient when the blood sugar up to 130 depend again to patient kg, the weight, you will make the formula. Yeah, like Dr. Alba
Because we have
sometimes.
from the formula to over 25, over 50,
Yes.
over
4.1
100.
now, the
Yes.
insulin rate was 4.7, so his weight was 47 kilo.
Yes, and I will give you example. The CBS 150 and 150 and the sensitivity over 25. How much you will give to the patient? 150 minus 100
100.
equal 50.
50.
50 divided 25.
2.
2.
2. See? And 150, like some any normal patient, it's nothing. But for some patient, no, you have to give 2. Any question?
Yeah. This
And all
for this-
decimal with the point above 0.5 will be considered as 1.
Yes.
One unit.
Yes.
Above 0.5.
Above
About
0.5.
0.5.
Yeah.
Exactly.
0.5. No, fix. Above 0.5.
Below like 0.4?
No.
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 0.5?
0.5 and above plus 1.
That's
Even
one.
Yeah.
Tala
one.
has to give.
Yes.
She said
No. According,
give.
يعني example, the equal مثلا 1.4, you will give only
only
1.
one.
But if you reach 1.5, you have to give 2. Correct.
What else,
For
Anisha?
our patient, she gave this morning the
6 o'clock
6
she
o'clock.
gives
She
snack.
gave the snack and she gave the breakfast.
Okay.
The
Is
insulin
snack?
according to
Like, how to give snack and the breakfast together or
no.
No,
Simple.
snack,
You
because
Breakfast
this
will
patient
come
has
at 10
no
o'clock.
breakfast, so he wants to eat. So we give him a snack. I need two carb only we give.
okay, you
Like
give
a snack, and it's considered as breakfast also. But he can eat after 4 hours another.
yes.
Yeah, so
But
then
anyway-
after 4 hours, if
But
I want
snacks,
to,
okay, because here the kitchen it's not working at 6 o'clock.
Ah.
Yeah, you can give what you have and equal according to the carbs.
Our insulin is what, no?
Apidra.
Apidra.
Yes, like you give 2 bread, you give and each carb how much?
3 only.
3. You give 6, and after what you are saying after
After
4
4
hours, you give the breakfast.
Yeah.
So
It's
I
fine.
can give the same.
Yes.
Yes.
So I can give the breakfast order.
Yeah.
Same like the
Yes,
insulin. Yeah.
but after 4 hours from last meal. Why? Because you know this Novorapid or Apidra, it's working till 4. If I give before, it's you give like 2 doses.
Yeah.
How the patient become hypoglycemia. That's why we wait till 4 o'clock.
But
Till
it
4
should-
hours.
But it should be given before food. There is she
Doctora-
mentioned before food.
Yes, Dr. Nasim different against school from
Yeah,
Dr. Thana. Dr. Thana for each patient and her own patient, insulin give after the meal because you want to calculate how many carbs the patient. Dr. Nasim no, she want before.
Different.
That way,
Maybe
ask
sometimes
the
the patient
patient
Better
whether
to
to
ask the
use it.
patient, you consume or you
Yeah.
consume all this.
But
Yes.
some patient they are telling, okay, I will eat this one and this one.
Ah.
Maybe they cannot. Then we will give the insulin. Maybe they cannot finish that food. What we will do?
That's why I'm telling you, and I already discussed this issue with Dr. Nasim.
Yeah.
She said no, if you give the insulin before the meal, it's much better Because you know the patient, the child, he took time during the meal. It's give to the till the blood sugar become high. That's why she won't give before. When the patient start eat, the effect of insulin it start together.
You know, last day one of my patient, he said he will take the whole rice and the soup. Then he started to eat. I think he take 1 hour to finish the rice, and he cannot take the other food.
Instruct within
And
30
you already
minutes
give
only.
insulin.
Yeah, but Dr. Shaima, she's telling after 30 minutes,
Should finish
I need to remove the food from the room. Then within 30 minutes, maybe he can. He's taking only soya food. I gave already the insulin. So what I will do?
You mean you give already the tray for the patient, and you ask the patient you have to eat all because I give you the insulin.
Yeah.
Yeah.
The patient he eat like 2 carbs from 4 or 3 carbs from 4.
Yeah.
Okay, you inform the parents or the mother before you give the insulin. Your child should eat 1, 2, 3, 4 because I will give full dose.
Yeah.
Yeah.
Okay.
Already we instructed,
Yeah.
but he's already
but
more
you
than
know,
12 or 13
It's
years.
taking more than 30 minutes.
And 1 hour, I think he
It's
took 1
okay.
hour.
It's okay here
Ah,
because
yeah.
he already took the dose.
3-1.
3-1.
Okay, because the insulin it's already working.
So some children, small children, you know, it will take really
For
time to
the
eat.
for the small children, you give after. In the Dr. Nancy presentation, she said
Below 5.
below 5 after
After food.
food.
But this one was more, I think, 12 year, more than 12 year.
Yeah,
But he took almost
she's big.
almost 1 hour to finish his rice.
Okay, good. But next time, it check with the
Maybe
patient. Okay, this is the
Maybe
tray.
that is due to our quality of the food.
Okay, this tray have like 2 cup of rice, 1 juice, till مثلا 6 carbs. What you want eat? You want eat all? Yes. If she said no, tell me exactly what you want because I will according to what you are said, I will give you the insulin. Okay, to be safe.
Yeah. Yeah, but we gave already the insulin and he said he will eat the whole food. But
Okay.
he cannot finish that one within 30 minutes. What we
She
will
need more.
Yes.
Okay. That's why I'm talking. Should the patient take the insulin before meal? Because if the patient he took more than longer hours,
Yeah.
it's already the insulin working. But the
Because
issue is,
this one I gave the insulin 12:45. He started to eat, I think.
immediately.
Not immediately, 30 minutes after the insulin.
Why?
This-
What you give
this one the insulin.
regular?
Yeah, that one.
Okay.
After 30 minutes he started to eat.
Okay.
Then he finished more than 1 hour to finish that food.
Okay.
So I think the next time I need to check after 2 hours.
Yes.
So
From the patient finish. Not
no,
like,
but he didn't finish within that time. So I
you
did-
will extend the
yeah, I
yes,
didn't
the-
check that time. But the next one I checked, then he was already hypo.
Why hypo if she eat all and she take full dose? Maybe the dose it's not. She need to reduce the dose.
Maybe
Because she did not consume the food.
Maybe the patient didn't eat well. We don't know. Maybe they throw it.
There's
Don't
one
know.
instance
We
for
cannot
chemo.
sit in the room
Actrapid.
for this thing. We are giving the food and after that we are taking the food.
Habib, should all the parents with
Should be
handling
instructed.
diabetic patients,
There.
they know everything about the diet, about the insulin, about the effect, about when they give the insulin, because you know that they do this exercise every day. How many times? 4 times.
But how
Then
hours?
how come the
Maybe more than 1 hour can consume the food or
Should be below, but if
But,
before, but if the patient he took already the insulin, it's okay. It's okay because he start insulin and he
And
start
she
eating
and
with
Dr.
insulin
Shaima, she
together.
was telling,
But
why you allowed to take 1 hour? You have to remove the food after 30 minutes. Then after 30 minutes only he took only 1 or 2
half,
spoon.
half.
Not even half. I went inside. He was
Next-
starting. Yeah.
What you will do next meal or when the patient finish, you will assess the patient what he's doing. You call me or you call Dr. Shaima. This patient we will make a different regimen This patient can be eat مثلا give the insulin after meal, case by case, okay, to be safe.
Okay.
Yeah.
So
I
we'll
will
call
not
the
give- I give
educator.
this
That
for
is
whole
your
patient.
observation. Actually, the nurse should observe. You are the one to tell the doctor this is what's
Yes.
happening when we are.
This is
giving-
patient 1, 2, 3, doctora. It's not like other patient. What you want to do,
Yeah, yeah.
Mm-mm.
okay?
My one patient, mom, was receiving Actrapid last time. For Actrapid, you told me after 3 hours from the insulin, we need to give the snack. At that time, the
I am not
postprandial.
agree with the snack.
Yeah.
Okay, this is doctora, but
Yeah,
the,
for
the theory
for
and
Actrapid,
for the يعني I don't know about my studying. Actrapid with MPH only you give the snack, but Actrapid with long acting, no need snack. But now we have to follow the order. You said Actrapid after 3 hours you give the snack. Okay,
Yeah.
then
And then that time postprandial, and then on the 3rd hour, I check the CBS. It's 165. I give the snack.
okay.
Then I left the room already. And then after 1 hour from the snack, I want to check again because that will be the 4th hour from the main meals, huh?
It's
When
not correct.
When I go back at that time, the sugar go down to 41 because he eat only half of the snack.
Again, please, the patient eats meal, and
Meal.
after 3 hours,
I check the
Give this-
CBS, ma'am. It's 165 because
okay.
I want to check if I will give snack or not. Because according to Doctora, if above 200,
No need.
no need to give the snack. But
And-
if below 200,
You
I
get
will give the snack because it will go down after.
Okay.
So, after an hour, I go back to check the CBS because it will be from the 4th hours, huh? He finished only half of the bread when I saw. And when I check, it's 41 only the CBS.
Okay. What you will do? What you are did for this patient?
I give juice until it reaches
The other half of bread, where is it? Or the snack only half a bread?
Half.
Half
Still
only.
here.
Okay.
Still
You will give this exercise, or for this patient you will give juice. Why? You know, because sometimes the main dose, like for breakfast or lunch, I don't know which dose the patient have hypoglycemia, and okay, maybe for this patient the insulin for last meal it's too much for this patient for this
He's
meal.
on fixed dose, ma'am. 15.
Okay, next time doctor, you will inform doctora to reduce it. Some patient, it's not about the dose. The patient has hyperatrophy or lipoatrophy. What's the meaning of? I give always insulin. The surgeon she knows, and the insulin it's become like balloon.
Yes.
You will
Stick
inject
parent.
under the
That's why
skin, and
better-
suddenly the absorb it come in one shot.
Mm-mm.
That's why. Sometimes not about the dose, about if the patient have any hyperatrophy or lipoatrophy. It's any sign from the dose.
That's why you need to ask where's the last.
It shakes.
Ah.
Yes.
the insulin. For example, for today, like that. Or in
In
your
this side.
shift,
In this side.
one side, and then the next shift will be on.
And what I want to please for endorsement for the for diabetic nurse like this patient, when she endorsed the other nurse, still she should tell about when she give in right side or left side.
Mm-mm.
Okay, it's help yeah,
Yeah.
for treatment. Again, any question?
Anything else?
Ginseng? Anything? Finish it?
If there is anything, I will
Call me. Really, I am talking. She knows me since 16 years. Don't hesitate. Okay, I'm sorry for last 2 years I am not here about my health issue. But alhamdulillah, I am here. You can reach me. Maybe not in the all the time in the hospital, but I am over the phone. I am not here. I have 3 of educators, Masha'il, Wafa, and Zaina. She can. I will tell them what we'll do, then she will come to you immediately. Okay? About you still using this one or the insulin pen?
No,
This one.
This one,
Mm.
very good. Okay, about the CBS. Sometimes the issue from the procedure of CBS. Tell me how to check the CBS from the patient.
side of the
Side of
Yes.
Clean.
clean
Then
just dry it.
you can massage first,
Yes.
like that,
Mm.
and then clean,
Mm.
and then prick from this
The side.
Okay, then
and then
First to
Uh,
control.
first blood, wipe, and then
Second.
roll
for
the-
dry tissue.
Dry.
Dry or
Yeah.
gauze.
You will take the other.
the second.
Why? Because sometimes the story from the
Alcohol.
patient, it's become always always high. What you are doing, he is not clean. He eating before the procedure, the blood sugar it become high. But real, no, the patient maybe is normal or below
Mhm.
hypo. Okay, because some glucose in his fingers, then it's come from the
And guys, some of our patients check where is the most they are pricking, because some of our patients is complaining, they prick me here. It's very painful, like that. Sometimes even the prick you can see until 2 days. The last prick is you can still see the prick from here.
Mm-mm.
So
You have to
miskin
use this
the-
one, two, like that, no?
Yes, you will adjust. And now most of the patients using the Freestyle Libre.
Yeah.
The Freestyle Libre, it's the sensor. I'm already using this because I'm diabetic patient. I will show you
yeah, some of the patients they have.
Yeah.
this one.
Mm.
Okay,
Yeah.
this sensor. Okay,
This can-
it's easy. It's easy for applying. Okay, and we will apply here immediately. Just I will make a scan.
Oh, you have there.
I will make a scan by
There is some
phone
patients
for
with
application or
You're
Or-
diabetic?
Some patients.
Yeah.
Dr. Jamal has like that.
yeah, Sir Jamal.
I saw him on the head.
Okay, this is the application. Just ask the patient if he's used Freestyle Libre, just to check glucose and make a scan. It's my blood sugar. Okay, and also it's very, very, very nice this one because you see the trend arrows. You see the trend, 114, right? There is a trend arrows is stable. My blood sugar is become stable. Sometimes it trend making up,
okay.
going up my
Or
glucose
down,
or going
hypo
down.
like that.
I show you my report.
So that is nice.
That
Yeah.
is 85, no?
No need to prick and prick.
No. This is the
But
yeah, but I have a lot of hypos. Logbook. Okay, here stable. Here on my history. So I will show you the difference of the trend arrows.
there show is
68.
control, no?
See
Oh,
here we
there.
come
Yeah.
down
Yeah.
slowly, but sometimes vertical down, 90 like it's going rapid down, okay, or up.
So this one is nice, no? No
Mm-mm.
need to prick, no?
Yes, and I have.
Maybe that is expensive.
It's not expensive. 250 each 14 days.
Ay.
Every 14.
Every
14 days
For,
you-
per month I need
Why
only
you will
500
take
and covered
bath?
by insurance.
Yeah.
While you take bath, you will remove this one.
Yeah.
How to put that one on the like
It's
stick?
easy. When I remove this one, I will make if all tomorrow here, and I bring my.
You yourself can remove that one?
Yeah, it's a sticker,
Like,
but
like
there's
sticker only.
microfilament. The one it's like cannula. It's
Ah.
already subcutaneous, and it's this one. It can read the glucose.
It's like with the insulin pump.
It's
Something
not.
like that.
It's not similar, but it's not the same insulin
Some
pump.
patients there is before Dr. Ratana patient also use here.
Yeah, but
She
it's
prick.
very nice. It's very nice,
But
really,
that time
and
it's
it's helpful.
expensive now when Dr. Ratana was here.
Yeah,
Said it
before.
available only in US like
Yes,
that. she
yes.
said.
Now
Now
it's
it's
available
all,
and covered by insurance.
yeah.
The Ministry of Health, she give by free for all type 1 diabetes.
Oh.
And it's available in institution and in the private. I take it by insurance. I not buy this one.
Good.
Now it's covered and it's helpful. Even when you check to the patient, خلاص no more finger breaking, just a scan and you check. But you have to know it's not blood. It's not measuring by blood. It's by interstitial fluid. It's different by blood. When you make comparing between this and the blood, you
Still
have to check the blood first and you wait 5 minutes and then you will make a scan. Why? Because the glucose now in the blood need 5 minutes to go from glucose from the blood to interstitial fluid. Okay? And for your info, this message.
So the result will be the same.
Yeah.
If you will check,
Yeah,
it's the same.
I know, خلاص. Alhamdulillah.
So why our patients still we are doing the?
No,
They can use that one.
they don't know. If
They
I
don't know yet.
Yeah.
Sometimes I'm asking our patient, you have the machine? He
Uh-uh.
said, okay.
Usually don't give all the patients.
Not all
like,
patients.
Because it's not
especially for
available.
the
It's not available from the hospital.
So from where?
And
It's
we are
good for the
trying. I
pediatric
appreciate.
hospital nearby.
Those below
Yes.
5 years old. So that they
Not
not be
recorded.
very
Yes. And I try and I put in my business plan, but according to
It's
the
good for the
below
below 5
hospital
years
still.
old patient.
Yeah, because it's good.
Because traumatized
Yes.
for below 5 years
And
old.
we have to appreciate our patient for the good food from this hospital. Maybe that's the reason they are not taking well. Sometimes they go hypoglycemic.
But again, if you need, please call me.
Yes.
Inshallah, and I will come immediately, or I will answer you over the phone.
If
Okay?
if we encountered another regimen, or we have in doubt again, we will call you again for another
Call
series
you
of lecture.
anytime. You know my duty till today. Wallahi,
11.
And I
Go home
I
early.
can't-
Adjust the timing.
No, I am happy because you want to know
Mhm.
about not about the issue. It's
Yes,
gone,
yes. Mm.
but no before you know how to deal with the patient during Dr.
Dr.
Athana.
Atana is
Nothing
this,
it happened like this. But
It's good teaching, Now she's
Yes, she's a teacher.
Because
she's
we have the
teaching
list.
us also.
The list
Diet
of
list
the
and-
food
Diet list.
with the
carb.
carb count.
Until now,
Because sometimes they forgot to put the
Carb.
cards. So at least we have reference, at least when
We have
hit
before
all the...
Okay, and I will ask the dietitian
Mm-mm.
to prepare something for you, but I don't put this one under your responsibility. You check the tray. Don't give to the patient. If the patient late, don't give food. Till the dietitian arrive and she give the card.
And all
The
the
usual
time,
food that the patient is eating.
The
Yeah.
list,
One.
the carb, they are writing
Just
the carb.
only want to know the list.
I have book.
Guys,
I have book. I will give it to you and I will
we'll
bring
just print the
now.
copy. Okay.
I will bring
Then
now
I will
and you will
ano.
make. There is a chapter for the
and how
cards.
many times I'm telling to the kitchen already, if you will not call them, they will not bring the snack.
And then,
Yeah, but Anna again, I am a
Sometimes we
nurse.
cannot write
Anna,
the
I am a nurse.
tables.
And I will not take any single responsibility.
Yes,
It's not
it's true.
about my head. Because when they have issue, they complain you. They not complain the
Yes.
dietitian.
Every time I'm calling, Kuya, can you give me snack? Because they should know this patient is diabetic.
So that's
They
why
should
remember-
They allowed to give the snack even if we will not ask. No, they are not giving. Unless
Also
we will
the
call, they give
apple
the
juice,
snack.
Latifa.
Also sometimes
You have to make here storage.
we don't have.
Make request.
The cafeteria last time they said they don't have available apple juice.
لا, tell Mom Abir. Make order and
Yes,
give it to me.
it's true. I went in other unit, and even in nursing office, I reached there just to get the apple juice.
La. It's not right. Before here, they are keeping here.
We are keeping we have there in the ref, but if there are times that we really don't have the apple juice.
لا يعني like you are a head nurse, you will make example every day. You will keep 6 with some sachet of sugar. And check and each the nurse she gives to the patient. She will endorse. Then if finish, you will refill again.
That's why I told them at night, those apple juice that are not used by the patient, put it in the fridge.
I put
Top
in my
of the
cabinet
stainless
apple juice
cabinet.
for my
The
patient.
card counting already
there, huh?
outside.